Hi all, this is Vaishali, clinical dietitian from Magna Centers, Bangalore. Here we have Dr. Anantharaman, endocrinologist from Magna Centers, Bangalore. So, sir, uh, we have certain doubts. So, my first question is, how does intermittent fasting and diabetic works?
Okay, um, let me start off. We can talk about when we talk about intermittent fasting, we can talk about effects on various aspects of metabolism. So when we say metabolism, some people want to do intermittent fasting to reduce weight. Some people want to improve their diabetes. Some people want to improve their hypertension. So how does fasting work specifically for diabetes? So intermittent fasting is a let's look at what is intermittent fasting. Intermittent fasting is a technique of nutritional intervention where you don't take any caloric intake. You are allowed to take salt and water. There is no problem. And non-caloric food you can have, but you don't take any calories. That is, you don't consume any macronutrients like a protein, fat, or carbohydrate. All other things you can have, but micronutrients you can consume. Like if there is a micronutrient supplement, you can take it. It should not be a problem. But when you're doing an intermittent fast for a long period of time, you don't take any intake. So what happens when you do that? So the first thing that happens when you do intermittent fasting is that you use up the glycogen stores in the liver, and over a period of time the gluconeogenesis kicks in, or the glucose production from the liver kicks in, and also you simultaneously start breaking down the fats in the body. The fat stores of the body are broken down, and for many patients with diabetes, and even patients without diabetes, ketone production increases. So when the ketone production increases, paradoxically you will feel less hungry. I think many of you might have had the same experience when you do fasting. So you may feel hungry for 2 to 3 hours after having eaten food, but if you continue not eating anything for say 6 hours or 8 hours, after the fifth, sixth hour, you actually feel better. You don't no longer feel hungry. Why does that happen? That happens because the ketones which are produced due to fasting suppress your appetite actually. So it's a protective mechanism. Otherwise, we'll go crazy with our hunger. Okay. So the body also recognizes the fact that we may have to go without food for say maybe prolonged periods of time. These were actually very commonplace before 2-3 centuries, where we probably won't get food to eat. So in that time, if you feel hungry all the time, it will make life miserable for you. So after a period of say 6 to 8 hours of fasting, your appetite comes down and the ketones kick in. And the ketones also have a effect of stimulating insulin production. So if you have type 2 diabetes, the ketones actually stimulate insulin production, and so does low glucose value. So low glucose value does not stimulate insulin production, ketone does. But free fatty acids, all these things which are broken down when the when the adipose tissue gets broken down and free fatty acids are more in the blood, then again that will improve the metabolism, and the blood glucose comes down actually. So if you're having early diabetes or a pre-diabetic condition, so intermittent fasting can actually improve your insulin resistance also. So it may be useful by these mechanisms to improve diabetes. Okay. So this is in short about diabetes and the metabolic effects of intermittent fasting.
Okay. So, how many types of intermittent fastings are there, sir?
Yeah, this is again a interesting question, because intermittent fasting can have various types actually. So the most common one is something called a time limited eating. So time limited eating refers to eating for only say 6 hours out of 24 hours, or 8 hours out of 24 hours. Some people say that dawn to dusk eating. So it varies from season to season. During the winters, the dawn to dusk may be just 8 hours. So you will consume food only for 8 hours. You start when the dawn happens at 6 a.m. So you start eating, and when it's at 6 p.m. you stop eating. So it's a dawn to dusk eating, or a time limited eating. The rest of the time you don't consume any food. You can have water, salt, minerals, all these things you can have, but you avoid eating food. So this is something that is one type of time of intermittent fasting. Other types of intermittent fasting includes little prolonged fastings. For example, Jains do a fast where they do for days together, they don't consume food at all, say 5 days, 6 days. Some people do even longer duration. So these are religious fasts also, and people do it for metabolic improvement as well. So they do a 2-day fast or a 3-day fast. Also, very commonly people do. This is called this is a seasonal intermittent fasting. So the classical example is actually Ramadan fasting. So people do Ramadan fasting from dawn to dusk, and only after dusk they consume food. So this is a seasonal intermittent fasting. Then another type of intermittent fasting is a regular intermittent fasting. So people do intermittent fasting only on weekends, like that. So all of these will have probably slightly more different metabolic effects based on the frequency and the duration of the fast, actually. So we cannot look at all intermittent fastings in the same way. The most common one patients employ is actually the time limited eating. Okay.
And sir, is intermittent fasting safe than other diet methods like keto diet, paleo diet? Compared to them, is intermittent fasting a safe method to follow?
Yeah. One thing I'll tell you, all methods of dieting are safe. So dieting and exercise are always going to be safe. There is not going to be any problem with the safety of the diet. But all diet, especially such methods, have to be supervised by a experienced dietitian like Vaishali. Okay. So basically, what happens is if you are on medication, say for example, you're taking sulfonylurea, you're taking glimepiride, metformin, which is the most commonly prescribed drug for diet for diabetes. And if you start doing a fast after taking the tablet, then you will get into a hypoglycemia in 6 hours. Okay. Whereas certain other medication, like only metformin or vildagliptin metformin or sitagliptin metformin, these don't cause hypoglycemia as much as glimepiride would. So if you are on medication and if you are planning on intermittent fasting, by all means you can do it, but it requires some supervision by a medical professional. That is either your primary care physician who's experienced in diabetes, or your or your endocrinologist like myself, or a nutritionist, clinical nutritionist like Vaishali should help you understand what you need to do. It can be just a simple suggestion. You just change the drug, then you start the intermittent fasting. And those who are having very high sugars and doing intermittent fasting, and because they are taking medication to reduce the sugar, they should monitor the glucose regularly when they are doing the intermittent fasting. And nowadays, over the last 8-9 years, what I see is that before Ramadan fast, patients always come to me to get their medication changed before they start the fasting. So they would like to do it safely. So this is one thing which happens every Ramadan. So we do get a lot of patients in the weeks and months before Ramadan. They'll ask me to change the medication for Ramadan so that they are able to fast safely without any hypoglycemia. So likewise, if you want to do intermittent fasting to improve your health, you need to consult your doctor or a nutritionist.
Thank you, sir, for sharing your thoughts on intermittent fasting.
Thank you, Vaishali. Thanks for asking the questions.
Yeah, thank you.